So I'm going to get started. Hello and welcome to Coffee with Dr. CJ. I'm Dr. Cathy J. Campbell. I'm a sports medicine, family medicine physician at Cleveland Clinic, Canada, which is located in beautiful downtown Toronto, Ontario, Canada. We started this weekly series at the beginning of COVID-19 for a variety of reasons to tackle some of the specific problems related to COVID-19. We looked at parenting through COVID-19. We looked at trying to exercise through COVID-19. We looked at how to make bread when there's no flour or yeast. We've looked at a number of topics and issues, and we've had a lot of fun. This is webinar 11, and today we're talking about moving mindfully. But before I introduce you to our stunning guest speakers today, I would like to thank Cleveland Clinic Canada, in particular Mike Kessler, who's our CEO, and the executive team at Cleveland Clinic Canada for the incredible support that they've given to all the staff. So they've kept us amazingly all working through this COVID-19 time and have been inspiring and motivating and tremendous support. So thank you very much to Mike Kessler and Cleveland Clinic. And we have two clinics in Midtown Toronto and downtown Toronto. And we're all working and we're all here and we're all starting to open up again. So wonderful. We have been seeing patients the whole time through this COVID-19, often virtually. So it's been a challenging time for everyone. So my two speakers today are fabulous. We have Janice Kessler, and Janice is a personal trainer and yoga specialist at Cleveland Clinic Canada with over a decade of experience in health and the fitness industry. One of her many specialties is training patients to use proper movement patterns through various exercises and yoga postures. She helps her patients gain strength and flexibility, improve posture, which makes me want to sit up straight here, Janice. Thank you. I know you're watching. I'm watching you too. Through proper movement patterns, and she helps to relieve pain and prevents repeating injuries by correcting posture and positioning. Her techniques have helped patients of all fitness levels to increase their body awareness and accept limitations and improve their overall sense of well-being. We also have Jeff McAleer, who is the lead of our exercise physiology department. He's a certified strength and conditioning specialist with over 20 years of experience. He's got a wide range of clients from exercise newbies to professional athletes. He's an advocate of mindful activity and encourages an internal focus to exercise. His efforts are focused in reducing pain, increasing body awareness, improving movement patterns, and developing strength skills through enhanced nervous system function. So welcome to both of you, and hope you are well, hope your families are well. I know that you're both parents and busy and so forth. Can you think of anything positive, maybe one positive thing each, that has come out of this COVID-19 for you, personally or business-wise? Let's start with Janice.
Thanks, Cathy. So I would say it's being with my kids. I have three young kids, all under 5.5. So being with them has been a blessing in disguise because usually I'm working a lot. So that's probably the biggest thing I appreciate.
Excellent. And Jeff?
I would echo that sentiment as well, and I would also say that the situation has shifted my stress in some ways. In that, of course, the quarantine and the pandemic has created a new kind of stress. But at the same time, working from home and no longer commuting to and from downtown, less traffic out on the streets, that's kind of dampened down some of the stresses that I was experiencing before.
Mm-hmm. Well, it's an interesting time, and I think it's been provided an opportunity for all of us to kind of rise up and grab the opportunity and try to see the positive in it. And clearly, both of you have done that well. So our topic today is mindfulness and moving mindfully. And I'm going to put you on the spot, Jeff, and ask you, what the heck does that mean? I'm going to be going for a bike ride today, and I'm going to go for a jog later on. It's a gorgeous day. And how do I do that mindfully? What does mindfulness mean? And do I use it when I go biking?
Yeah, that's a great question, Cathy. And I think as a concept, mindfulness is quite simple. As a practice, not so much. Mindfulness essentially is the practice of being fully engaged in the moment. It involves an increased awareness of our thoughts, our feelings, our body sensations, our surrounding environment. So in terms of how does it apply to biking or running, for example, when biking, if you're increasing your level of mindfulness while biking, you might be more aware of how your feet are interacting with the pedals. You might be more aware of your hands on the bars, certainly more aware of your posture. Is your core engaged while you are riding?
So it's not really some woo-woo concept. It's really about being present, it sounds like, in the moment. So when I'm out biking, looking at the gorgeous red-winged blackbirds, rather than thinking of the emails that are waiting for me when I get back. It's seizing the moment, if you will, it sounds like.
Yeah, 100%. Feeling the wind in your hair, hearing the birds. And even from a safety perspective, if you're biking or running, being aware of cars or other bikers on the road, being better prepared to handle any type of surprise that might come your way.
Now, preparing for this talk today, I read a little bit about mindfulness and found that there are a lot of benefits to mindfulness. I found this slide and I thought perhaps, Jeff, you would speak to this and if you have examples of how some of these have worked in terms of benefiting us when using mindfulness.
Yeah, so as you can see on the diagram there are a few items that benefit from mindfulness practice. The research suggests that there is a technique for acknowledging, confronting, accepting pain, which will help to actually ease that sensation. Certainly, the research is quite clear that mindfulness and that sort of some of the techniques that are involved in it help to reduce stress and anxiety and calm the body. In terms of managing emotions, the idea there is by being aware of them again, sort of understand how you're feeling and how you're responding to certain situations. Again, accepting them rather than sort of fighting them. Yeah, and the last one there, I would leave that one to the psychologist to discuss.
Yeah. Well, these are all great ideas, and certainly anxiety and stress are huge during COVID-19. And many of the webinars and podcasts that I've been involved with have spent a lot of time talking about that because first we've been anxious and stressed about getting COVID-19 or giving it to our loved ones. We've been anxious and stressed about financial concerns around this time. and anxious now about returning to work and what that means. So it sounds like, besides, although we're talking about mindfulness and movement and so forth, it's really, mindfulness is excellent in all aspects of our life, it sounds like. So in terms of breath awareness, and I'm going to keep picking on Jeff for a minute here, is I've heard you both speak about breath awareness and breathing and the importance of this. And so what does this mean and why is it important, especially when we're speaking about mindfulness?
Well, I think that breath awareness is one of the keys to sort of entering into that present moment, is just sort of being aware of your breathing process. You know, are you breathing deeply? Is your breathing shallow? Are you holding your breath? So in terms of the mechanics themselves, you can work on those mechanics, and certainly the research is clear that sort of deeper diaphragmatic breathing is an effective means of managing stress and anxiety. And the research is also suggesting that it also positively affects a number of other health risk factors, such as diabetes or hypertension, elevated cholesterol, depression, pain. So sort of that's kind of a starting point, is increasing that level of breath awareness. And that's going to help sort of bring you into the moment. More often than not, it's bringing you out of your head and sort of into your body a little bit more.
So it forces you, I guess, to be even more mindful if you're thinking about breathing. I mean, it's hard to think about emails when you're thinking about your breathing, I guess, right?
Yes, and I think you can do both. You can do both. It just helps you sort of look at your emails with a little different perspective. You know, more sort of dealing with them in the moment, rather than, you know, going on that roller coaster ride of sort of what that email could potentially mean, or what my response could potentially lead to, et cetera, et cetera. It just sort of centers you and allows you to make the best decision in that moment.
And I think Janice has a comment as well.
And what I would add is, you know, when we're doing our daily life, we don't actually realize when we're actually holding our breath. So if we actually pay attention to, you know, are we holding our breath when we're cooking, or when we're dealing with our kids or our spouse, or on the phone, and we're actually aware of those moments that we hold our breath, then we'll be more aware of it. You know, if I'm having a talk with my daughter and she's like on her bicycle, I'm afraid she's gonna fall and I'm holding my breath. But if I know that when I'm watching that in that moment, I'll be more aware of to tell myself, Janice, take a deep breath, it's gonna be fine. Just to have that awareness and the consciousness behind those key points.
Great. I'm now gonna turn to Janice, and so mindfulness, we've discussed a little bit. We know that some of the benefits of it, but how do we do it? When do we have to practice it? And if we do, where do we practice it? And what are your suggestions around that, Janice?
Yeah, so it's something that we need to practice, and it's not that easy. And what, like Jeff said, there's so many benefits to being mindful, and given this current environment, we need to actually pay more attention to it and try to be mindful in everything we're doing. And so what the easiest thing to do is to start very simply. So what I would suggest is, you know, if you've never practiced mindfulness before, try to do it in a quiet place. So lying down is much easier than standing or moving. So if you're lying down in a quiet place, you can pay attention to your body, pay attention to what you're feeling, and be present. And what's important to note is you want to also be, when you're present, you're also having no judgment with what you're feeling, because you have to accept what you're feeling and go from there. So if your body's feeling pain, that's okay, as long as you're aware of the pain, because a lot of clients that I see, they're not even aware that they're having this pain when I'm working with them, for example. And mindfulness takes discipline. For example, being mindful on this call for me, for example, would be much harder than me lying down on my bed trying to be mindful. But you have to start, you have to start simply, and then when that is easier, then you try to go to the next step.
Mm-hmm. Great ideas. Now, yeah, you had mentioned when we talked earlier, it was being mindful in a meeting, for instance, is more difficult than being at home in a quiet place. So it takes a little more effort, but I'm assuming that by practicing it in that quiet place, you can improve the technique so that you can use it more easily or readily in other places.
Exactly. So you could also take we call it mindful breaks. So, you know, in your day, you could set alarms, whether it's 9, 12, and 3, and you set alarms on your phone to take just a mindful break for a minute or two. And if that's easier, then it can expand, just to get you in the habit of doing it, because when we get into our every daily activities, we might just forget. So an alarm on our phone that dings us.
And I'll just jump in here, Cathy. You know, and going back to sort of what we were talking about in terms of breath awareness, you know, one simple technique that you can use when you're lying on the floor, let's say on your back in a quiet place, you place one hand on your belly and one hand on your chest, and just start breathing, ideally through your nose. And with a proper diaphragmatic breath, you'll find that the hand on your belly is expanding on your inhalation and it falls on your exhalation. If your chest rises at all, it would be last. In other words, the belly rises first. And if you're getting a really deep breath, you might experience some rib expansion there. And then in terms of these, you know, timed mindful breaks during the day. You could also use that minute or two to take 5 or 10 sort of deep mindful diaphragmatic breaths. That's going to help sort of reduce the level of stimulation of your fight or flight system and increase the level of stimulation of your opposite, your rest or digest system, and immediately sort of lower the stress and anxiety response that you might be experiencing.
Great. I also like the idea of Janice's setting those alarms. You know, I spent a little bit of time in Turkey once, and regardless what religion you are, they did have this call to prayer 5 times a day. And I thought, what a great thing to, you know, 5 times during the day. It was this reminder to appreciate where you are, what you're doing, who you are, and so forth. And so maybe setting the alarm is kind of would be a great trigger to engage in the mindfulness process. So Janice. Janice is very humble and she's a real rock star. And I had the honor of spending 30 minutes with her one time last year. I thought I was going to do a little exercise program. And before sending anyone to any patients to anyone, I always like to go through it myself. And the whole 30 minutes was about my posture. And I learned more about posture in 30 minutes, I think, than I'd ever known in my life, I think. It was a wonderful experience. And I have sent many clients and patients to Janice to help them with stooped posture and so forth. And you do a lot of work through yoga, but also just through your kinesiology type background in posture and breathing and so forth. And maybe you could speak a little bit more about what you're looking at and some examples of what you're trying to accomplish with your posture work.
Yeah, sure. So one question I always start when I I see a patient is I ask them, are you actually mindful of how you're standing? And most people don't even think about it. And so the best way to actually describe how to stand is I'm going to ask everyone on the call if they can just stand up, and I'm going to walk you through how to stand.
Okay,
And
everyone, stand up for the call.
Stand up.
Stand up. You're there now. You got the computer in front of you. Stand up. Come on. All right.
I'm going to use my trusted, this is my daughter's stuffed animal that they're actually afraid of. So I just found it, so it's easier. So if everybody can first look at your feet, and there are 4 corners of your feet that need to be on the floor. Okay, so there is underneath the big toe, underneath the baby toe, inner heel and outer heel. So if you look at your feet, you want to be standing equally onto the floor, so spreading your toes out. And because we wear socks all the time or we wear shoes, we tend to not train our muscles in our feet. So we want to really spread our toes, have our feet planted in the floor. So our feet are hip width apart. So if everybody can look at their feet, get them hip width apart, and you're going to look at your second toes, and they should form a number 11. The next point is our knees. At our knee joint, we want to make sure that we're not locking at the knee joint, because if we're locking at the knee joint, we turn all our muscles along on the leg, we turn them off. And we don't want to overuse our knee joints or our hip joints. So just have a slight bend in your knees. Then we're going to go up the line. I'm going to do the core later at the end. So now we come to our shoulders. So Cathy, you can even roll your shoulders back even more. Roll them back. So you're engaging your back muscles here. So this is really important to engage your back. And then your head. So if you're, as we see in the PowerPoint, if you're in a rounded forward, like a stooped posture, your head tends to go forward. So depending on where you are, if you really have a tight chest, then you're gonna pull your head back, and you're ideally the alignment is the tip of the air lines up at the top of the arm, of the shoulder. So ideally it's 180 degrees from the top of the shoulder down to the hip, down to the knee, and down to the heel. So that's the ideal posture that we want to be. But again, when you're mindful of how you're standing, you might not get there today. It might take a couple of weeks, couple of months, could even take years. It depends on how your age and how long you've actually been in this posture. So now that you know how to stand, we're going to engage. How do you engage your core? So that's a big thing, especially because nowadays we're not moving as much. We may not be moving as much and maybe sitting a lot. We have to engage our core muscle. So if you pay attention to your 2 hip bones right underneath your navel, they're on either side, there are 2 bony parts. And what you're going to do is you're going to pretend you're wearing a belt, and you're going to tighten the belt so you draw those bony parts together, and you're going to draw your navel to your spine. As you draw your navel to your spine, I need you to check in, are you clenching your butt? And a lot of times people don't even realize they clench their butt when they're trying to engage with their core. And all it tells me is that you don't have the strength in your core. You want to use your butt to actually support your back. And this can cause problems later on. So now that we have proper standing, you have to maintain that at the same time breathing and not holding your breath. So I'm going to let Jeff talk about how do we actually breathe in now a good neutral spine.
Just to ask a question, Janice, before we move on.
Sure.
So all of these are great ideas. And even though I've gone through it once with you, I'm not quite there. And I need a lot of practice and work. And besides coming to see you, if people in the audience are interested in working on this more, are there, and you can think about this and tell us later or now, are there videos or are there other reading or are there materials to help coach people through these exercises and reminders?
Yeah, I wouldn't say, I'm not sure there's a video. I mean, I'm happy to go over it if someone has a question about what that alignment is, because it's very specific. But more importantly, if you're not able to maintain a neutral spine and get to that 180 degrees that I showed you, then different things are going to come up. So you might have neck pain. You have to be mindful. What are you feeling? Are you having neck pain? Are you having back pain? Are you feeling, do you actually feel your muscles? If you don't feel those working, then I'd advise to actually get a postural assessment, and then you move from there, what the next steps are. It's not something easy to do if you've trained your posture to be slouched for 20 to 30 years or whatever the case may be.
And we have some information at the end of this presentation as well, so people can find you or Jeff, or you get advice at least on if they're not in Toronto or what have you, to get more information, excuse me, about that. Sorry, I cut you off, Jeff. You were going to talk about breathing and posture, and thanks for that, Janice.
Now, presuming that people are still standing, the sort of basic technique would, again, just if you were to place your hand on your belly in that standing position, take a nice deep breath through your nose. And again, ideally, your hand should expand, or your hand should lift away from your spine as you inhale and bring air into your system. And then again, it should fall with your exhalation. And if you're experiencing that, then we know that we're getting that breath deeper into the chest cavity. Just try a couple breaths there. As we mentioned earlier, just in terms of skill acquisition, starting on your back would be the easiest progression, and seated and standing and then moving while still maintaining sort of a level of breath awareness, that becomes a more complex challenge. I'd like to just make one point or a point on posture and take a stab at your question, a general stab at your question, Cathy. When we sit a fair bit, we develop certain muscular imbalances and asymmetries. Janice is very in tune to these. And the general approach then is we create a series of exercises to help unwind that seated position. And generally it involves opening up, the muscles in the upper torso and developing some strength in the muscles in the upper back. But certainly, the lower body can also develop muscular imbalances based on that seated position as well.
So speaking of seated position, I thought we would move into both seated posture and breath, as Jeff touched on. And so Janice, can you speak further about seated posture? I don't know if you need the help of your assistant from Dr. Zeus, I believe. And that is a great picture of you here, which I stole off the internet. So perhaps you could continue on there.
So just like you have to be mindful standing, you actually have to be mindful seated. And I always start off when I'm working with patients is to learn how to stand, because you're applying proper standing posture. Having a neutral spine, you need to maintain that posture when you're sitting at a chair. Are you, questions I ask people, are you actually mindful when you're at the computer? Are you guys mindful sitting now? How are you sitting? What are you actually feeling when you're at the dining table? When you're watching TV, there's different places where we're in different postures and seated position that we need to be mindful. Are we, leaning on one side a lot? Are we crossing our legs? We tend to do this a lot. If we're, ladies do this, we cross our leg over all the time when we sit, and that eventually will cause an imbalance of how your body reacts to that one leg over all the time that you're sitting. So what I'm gonna do is, just like we demoed together how to stand, I'm gonna walk you through how to sit properly. So if you're not sitting at a chair right now, if everybody can take a seat, I'll give you a minute to find a chair. And what you're gonna do is, I want your feet to actually be flat on the floor. So you might not be able to lean back on a chair if your feet can't touch. So depending on the chair, you might wanna scoot a little bit forward. And just like when you look at your feet, they need to be parallel to each other. The second toes form a number 11, and your feet have to be flat. So if you're finding that you can't have if your feet aren't flat, you might want to prop your feet up on a box or stacks of books, whatever you have at home, so that your feet can be flat. Because if they're not supported, then what happens is the leg muscles start to work, the hips get tighter, then that might lead to leaning forward because you're causing this misalignment. So first you start with the feet. I always start with the feet because everything, if the feet muscles aren't working, everything up the line has to compensate. And again, your feet, your legs, I like them to be straight. I don't like crossing over the legs. And then when we get to upper torso, you're rolling the shoulders back. You're pulling the head back so that the tip of the ear lines up with the shoulder. And how I tell people to visualize is I pretend that I have a string at the crown of your head, and I'm pulling that string to lengthen your spine upwards. So you should feel your core. It's like your core, your torso. I'm lifting it off of your waist, and that's the work of your abdominals, your core muscles, your low back, your back muscles, to feel that lift. Because when we get really, I find chairs, these are things that we have in these first row in like North America, where we have all these comfy chairs. We don't have to work. We can rely on the backrest. And where we look at other cultures where they sit on the floor to eat, they sit on the floor all the time. I remember going to China after university with my brother, and when I went to the washroom, and this mother with her young baby took a full-on squat, seated squat, changed her baby's diaper, and had no problem. I can probably bet that 90% of people cannot do that and fully just changed her diaper. I can't even do that so easily. I wouldn't do that. But it just shows you, because that culture is so used to having a squat toilet, sitting on the floor, always bending over, versus in North America, we have all the luxuries of a chair, for example. So that's how I would recommend sitting, is to use your core muscles, because the core is the foundation of everything. If your core is strong, it can prevent a lot of pain and a lot of injuries from occurring.
It's so important, this topic, especially with working at home, especially now. So I can't tell you how many injuries and musculoskeletal problems that I see in sports medicine related to ergonomics. People have trouble appreciating how important your posture at your desk, at your work, at home when you don't have the proper setup. Students with their laptops on their laps in bed, the neck problems, the shoulder problems, and so forth is huge. And so these are great tips for all of us to remember. We have to be mindful of our posture all the time, or we will get into trouble, especially with these long work from home hours that many of us are doing. So thanks for that. I think Jeff was also going to talk about breathing with seated posture. Was there something else that you were going to add there, Jeff? No, I think you talked about it last.
Yeah, it's bringing the same diaphragmatic breathing principles to the seated position. Again, using the hand as a cue, and breathing, inhaling into the hand and watching the abdominal wall expand and then fall on the exhalation. Same concept. The message is that it can be practiced in any position, really.
So can you explain what you mean by improving how we move and breathe? Some practical things related to that. I think, Janice, I was going to ask you about how to improve your movements. And I think Jeff, again, was going to target a little bit more around breathing.
Yeah, so an important point is that to mention is that one someone can't breathe properly if one's movement ability is restricted. So for example, if someone is more slouched over. So let's just do as an example. So if everybody can do this with me, if you slouch over, try to take a deep breath. It's very hard, right? And usually if their chest muscles are tight, it's pulling your shoulders forward, you're rounding, you can't take that deep breath. And so when we look at the alignment of the posture, and we realize, oh, your chest muscles are tight. We have to stretch out the front of the body to get those shoulders back. So if everybody now stands up, sits up straighter, rolling the shoulders back, and then now take a deep breath, you'll actually find you're actually able to take a much deeper breath than if you're in this hunched over position.
You know, what's interesting is that being an old track coach, you know, when people finish a sprint or an interval, the tendency, because you're exhausted, is to put your hands on your knees and kind of bend over and so forth. And if you can make yourself stand up with your hands on your hips, the recovery is so much easier and so much better. So just from another practical point, that totally makes sense.
And I would also add, in terms of movement, what do I mean by movement deficiencies? And what we look at in terms of our assessment is, can someone squat better? Can they lunge? Can they do a rotation? How are they actually doing these movement patterns? Because once you address the deficiency, then we can move better. Then you can move better without any pain, as well as breathe. So those are a couple of assessment tools that we do at the Cleveland Clinic, is assess overall postural alignment and figure out what a person's movement technique is and how can we make it better.
Right. So we have about 5 minutes left, and I have a couple of questions here. If anyone from the audience has any questions for Janice or Jeff, there is a chat box that you can send the question in, and we can take it from there. But first, I'd like to say, ask one question that came in to Janice, and that is, we're talking about posture and how important that is. Should we watch, one of the questions was, should we watch the posture of our kids, and how do we improve posture of kids?
Yeah, so I am a little OCD on posture, as a lot of people know me, and everything starts as a child. So when I have a patient that's, say, 60, 70 years old, they're like, nobody ever told me how I have to stand. And it never starts. I'm like, it didn't just start now. It started when you were a kid. How are you actually sitting? So with my kids, when they're sitting on the floor, I actually tell them it's crisscross applesauce, how you saw me in the picture. Well, not in lotus, but crossing the legs versus doing a W sit, where that can actually affect the hip alignment as one ages. And it always starts younger. It doesn't just start when you're an adult. So definitely, I would say you have to watch your posture. And if there's anything that you notice your child doing, it's something that needs to be addressed with a professional. Because if you change those alignment problems in a child, it actually sets them up to have better posture when they get older.
Excellent. One question came in for Jeff, and it's, how impactful is breathing technique? Does it really matter?
I think it's very impactful. In fact, you know, if I'm starting with somebody who's sort of new to exercise or new to some of these concepts, that's the first skill that I'm going to work on. You know, if we look at it from the standpoint of what our bodies require for survival, you know, there's the rule of threes, which is a general rule, but it serves a purpose. You know, we can last 3 minutes without oxygen, and we can last 3 days without water, and we can last 3 weeks without food. So that alone sort of illustrates how important oxygen is. Our body is, always looking to maintain homeostasis or some form of inner physiological equilibrium. And part of that is this very delicate balance of oxygen and carbon dioxide. And proper breathing techniques can certainly help to improve the general function of the entire system, just based on getting that crucial element into the system.
So we're almost at the end of time here, and I wanted to thank you both for excellent presentation and advice. As a parting shot, any little tips that, maybe one tip each of something for people to think about that they can take away from the talk today. I've also put some contact information if anyone is interested in contacting either of you for further advice or information. But maybe one thing that really stands out for you as important in our talk today on moving mindfully. Janice.
Yeah, so I would say everyone's mindful. How one is mindful is different for everybody. So you need to find what works for you. So what works for me in terms of my mindfulness is, say, my yoga practice. But for Jeff or Cathy, might be something different. So as long as you figure out what works for you, that's fine. As long as you're being aware and being fully present in what you're doing, that's the key takeaway.
Jeff.
I would point out that proper posture is a practice in mindfulness in itself. I think that, and Janice, you can appreciate this when you start working with somebody whose posture needs improvement. It takes a great deal of effort for them to put themselves into an ideal position of posture if they are able to. Well, certainly as you address your muscular imbalances and asymmetries, it becomes easier and easier to get to assume a position of proper posture. But that being said, even when everything's balanced, you still need to be aware and be active in maintaining that postural position. So that in itself, again, is a practice of mindfulness.
So thank you very much, Janice Kessler, Jeff McAleer, Dr. Zeus Characters, Sophie Fraser. Thanks very much. And thanks to all of you for today. Next week, we're talking about exercising with our kids for the summer and what to do with different age groups, especially if things are still not opened up yet. So thanks very much. Until next week. Great. Bye-bye.
Thanks, Cathy.